Hi, my name is Dola Abiodun. I'm an advanced practice nurse practitioner, a family nurse practitioner, and also a doctoral nursing student of Brandman University. Today, I'll be making my presentation on community assessment slotting journal. My community of choice is called Smyrna, and it's located in the city of Cobb County, Georgia. This is the community of my choice because I've been working in this community for the past 5 years. The population is about 56,000. The median household income is about $58,000 yearly, and 84% of the population has health coverage, with about 18% uninsured individuals. The ratio of patient to clinician is about 1 to 1,519 on average per year, and this is the same as the state of Georgia, and it's not a very good ratio. uh, Health community clinics in Smyrna. When I visited the Smyrna community, I found out that they have a lot of mostly primary and urgent care services. And these are the pictures of some of the primary and urgent care services. This is another picture of a medical clinic in the community. The local public health services, there are two health departments in this county that serve the city. We have the Smyrna Health Department, which is at the city level, and the Cobb County Health Department, which is at the county level. When I visited the public health site, they render services such as immunization administration, tuberculosis screening and treatment center. They also have the WEEK program, which is the special supplemental nutrition program for women, infants, and children. What else is needed? I feel like mental health is a big thing that is needed in this community. Also, specialty care such as wound care, neurology, endocrinology, and etc. is needed. This is a picture of the public health center that has the tuberculosis and refugee services, and also the Cobb County Health Department that offers the WEEK program. Vaccination rate. The vaccination rate in the city of Georgia. We have for children entering into school, we have the DTaP vaccination. And with the DTaP vaccination, it's about 80% that are vaccinated in the state of Georgia compared to 83% in the national average in the United States. The MMR vaccines is about 90%, whereby it's about 91% as the national average. For the varicella, is about 92.4%, which is greater than the national average of 91%. And this is all the combination. Also, the Healthy People 2020 target goal is to have the vaccination rate of 80%. So, as you can see, Georgia really meets the target goal for each for the children entering into school, but they can do better. Children that have no insurance can get vaccinated at the health department at a flat fee of $20 per immunization. I found out that flu shot can be gotten at any local drugstore and also at the health department for about 19.99, which is about approximately $20. Some drugstores such as Publix have it for free, so and this is very nice. The disaster planning. Disaster preparedness is done by the community by engaging residents of various media, such as the website, their Twitter account, the Facebook. They also offer training classes as part of their community emergency. To learn more, the community directs you to go to a website, which is this website right here, which is the Cobb and Douglas Public Health, and a phone number to call. The phone number is right there below. It's really nice. Examples of health education and promotion. I have like four examples right here. The first one is about having the child in the right car seat. It's like a billboard. The other one is also but about birth control. We have eat more fruits and veggies for the kids and don't drink and drive. They have quite a few health promotion and education in the city of Georgia, Smyrna. Community engagement. They have free HIV testing, which is strongly publicized on billboards to community residents to know their HIV status due to high increase in HIV infection in the community. This awareness is being promoted by the Cobb and Douglas Public Health, and it's extremely effective because it is free. They have a call to action right here. The phone number, there's the website right here that you can click on that shows the date and location. Also, I found a community resource fair flyer at a school location for parents to participate in a discussion engagement about different challenges that their adolescents are facing and how to effectively handle it. This was not as effective because it was not highly publicized. I had to search for it. It was organized by the Cobb County Public Education as a call to action right here with the meeting at the school, the date, and also the time. Community initiative called Sharing Services for Health is an internet advert that is part of the Childhood Obesity Initiative dedicated to reducing childhood obesity in Cobb County. It is engaging consumers, the residents, the organizations, the agencies, and business owners to offer more quality opportunities for physical activity. It was organized. It is organized by the Healthcare Georgia Foundation and supported by the Cobb County Health Department. This is a new initiative. It was just implemented in 2020. Therefore, you can't really evaluate that now. But I can tell it's going to be very effective. According to County Health Rankings report, to measure the level of healthcare services, one needs to consider health outcomes, health factors, or other factors contributing towards health. Therefore, different metrics will be considered, such as access to care, mortality rate, admission rate, for me to be able to measure the level of healthcare services in this community. It's really, a critical thing that really needs to be measured, but I have to measure it, critically. There is a need for mental health specialty for both adults and children. That's a significant part of healthcare services that is, uh, it is really not seen, it's deficit in this community. Also, there is a need to bridge the gap in racial disparity in this community. Public health education and promotion are needed to be in conspicuous location to reach consumers. These are all my reflection on the community. These are my references, and sorry. These are my references, and thank you for your audience.